Hi, well here we go. Lots of anticipation, lots of talk about spinal compression, lots of talk too about spinal decompression. Now remember, this is what you do yourself. Now, lots of the fitness industry is to do with exercises, as we know. Now, it's my view that too many of those exercises are done sort of willy-nilly with no real understanding why you're doing them and no real expectation of them actually working for you. Now, with the back block regime, although you do it routinely every night and get into the way of it and get into actually loving it, actually looking forward to it, you will also get into the way over time, as you become more confident, of doing it when you're in pain, to get yourself out of pain. Now, you don't do that quickly. Nothing happens quickly. It's a process of letting go, letting your spine ease apart. So you can't hit it hard. You have to coax it. So that's really, once you're more proficient, what I want you to do first off is just get not only to like it, but to get to love it. I actually say to my patients that once they're addicted to their back block, then their days of needing me are numbered, which is what we want. So to that end, I would like you to actually find yourself a little corner of your house, a little sort of sacrosanct back corner. Not that I want you having a shrine to your back, far from it, but I do want you to have a shrine to your getting better. And I do think it's a good idea to keep a sacred space. Well, yes, I do mean a sacred space, a special space where everything's laid out. So you might have a back block, you might have a yoga mat, you have your back block there, maybe you have a couple of my books there. I like you to actually do the regime without haste. So if you can have the radio on, well and good, because I don't want you clock watching. If you're actually counting the number of reps you're doing and counting the time that you're doing, you're not getting there. You're not getting it. I want you to actually relax into it, let go, go with the flow, go into the moment. All these phrases, go into your back and feel it letting go and feel the stuff, feel what you're doing, actually doing you good. Visualizing, trying to get a sense of the spine working like a concertina coming apart, getting a sense of fluid seeping into the discs again, getting a sense when you're doing your knees rocking that you're stretching the back wall and sucking fluid in, visualizing it all the time while you're doing it. So you can't be doing that while you're counting. What I want you to do is let go, and what you'll see with me doing this now in real time, that it actually takes a while. There's no hurry, and you'll flow from one movement to the next and back again. I like you to do the back block at the end of the day. I feel that there's less haste at the end of the day. I feel that you know that from your previous lectures that you've lost 20% of your discal fluid, so you're shorter, you're more compressed, the discs are drier, and that's when you want to get the disc pulled apart again. All the lumbar discs, not just one, although there'll be one level in your back that's worse, that needs the attention more. So you'll do it without any sense of urgency, literally, preferably before you go to bed. And then I think you have a better night's sleep. You actually undulate over the mattress better when you've pulled your spine apart. So you're sort of like a caterpillar pulling out. And it's a lovely feeling of abandon and letting go. You do get that much more at the end of the day. Having said that, some people will say that they actually get a better day when they do their back block in the morning. And over time, as you become more proficient, as you feel the back block working for you, you'll do it whenever you like. It's just that I want to induct you without mishap into the best way of doing it. And I also don't want to overload you. If I say do it in the morning and do it in the evening, which you may well do eventually, if I ask you to do that initially before you've seen and felt the benefits, then I will be more likely to lose you, which I don't want. Remember, this is very simple, it's very slow, it's very quiet, and it's a process that you do really for the rest of your life. So here we go. You never sit on your back block and then lie down. You always lie down first. Nothing's hurried. And here it is. And so you draw one foot up closer to your bottom, then the other, and then to do it all perfectly, you take the hands over the head, interlace the fingers, turn the palms away,